at least 10 days from the time the first symptoms appeared. And if you look at the time-based strategy or the test-based strategy, it's 10 days have passed since the development of, since the day of the positive COVID test, assuming that they have not subsequently developed any symptoms. And just to note, there are different recommendations per center. Some centers would recommend longer period of time for self-isolation. And I think that because we are in this era where there's just so much data that's being made, I'm pretty sure that these recommendations may continue to change depending on what new data is generated by all the other investigators that are looking at COVID-19.
Thank you for that. There's a follow-up question. Can you comment on the accuracy of testing being used, like the Abbott testing? Some report it has up to 40 to 50% false negative.
So the ones that, so the issue, are you talking about the serologic testing?
By Abbott?
Yeah, so if you look at the FDA, the emergency use ones, the ones that they've approved, the 13 that are there, if you look at the IgG that they're testing, it goes from 90 to 100% sensitivity and specificity. Now, the others that have IgM in it, they're a little lower for as far as sensitivity and specificity, and also with regard to negative predictive value and positive predictive values. Because there are so many kits that are out there, I would go to the FDA site, and you can see there, they actually have data on sensitivity and specificity of all the last time I checked, there were 13 tests that are being used or that are approved by the FDA.
Okay, thank you. There's another question here. When a COVID-19 patient gets discharged to home or a nursing home, do they still need to self-isolate? And what instructions do you give patients? Let's start with Dr. Sethna in terms of pediatric patients.
So in terms of pediatric patients, our hospital guidelines are to go home and self-isolate until you're fever-free for 3 days, and or you have your symptoms have improved after 7 days. Otherwise, it's just general guidelines: washing hands, isolating. And in terms of the NIS-C patients, technically they should not be contagious at that point. So they should not, they already have the antibodies and have had previous infections, so technically do not have to isolate.
Thank you. Dr. Makatangay or Dr. Chua, any in adult patients, do you give any special recommendations when you charge them?
Yeah, I think it's going to be something that's similar. So if you look at the CDC guidelines that I answered earlier, so it's like 3 days from recovery or 10 days from the time of the first symptoms. I think what is important is to really talk to the house or the family that's there. So for individuals who are discharged from the hospital that are just still, or not within that 10 days, or like 5 days from the onset, or are not yet fully recovered, they need to self-isolate, and you need to really be able to talk to the family about it, just because if there are some individuals in the household that are essential workers or people that are in contact with other individuals, as far as public health-wise, it's important for the patient to be self-isolated, or else there's going to be exposure to those non-essential or those essential workers. And given the fact that the shedding is increased or starts even prior to the onset of symptoms, then we'll have continued transmission to the community.
Thanks. The next question, what kind of mask should I wear? Can you discuss the different kinds of masks? I think Dr. Chua will enlighten us with this one.
Yep, so I'm muted, okay. So different types of masks. So we have the cloth masks that, interestingly, even on the CDC website, there's a pattern on how to do it, like a 6x10 mask. You try to do a double layer cloth mask, and other forms of masks would include surgical masks, N95, and even the KN95, which has been more available since it's coming from China and it's not from 3M or the bigger US manufacturers. But Honeywell seems like they're picking up on the N95 manufacturing. So for the general population, like people in the regular community, the cloth mask would be beneficial. And the benefit is it's like threefold. It's at least threefold in the sense that the main, like obviously we want to protect ourselves, so that's one of the benefits. The report is in essence, the cloth mask is probably about 50% effective for blocking particles from another person being transmitted to us. And obviously that depends on how close does somebody who's infected, the airflow, humidity, and temperature, and all those kind of play a factor in how a virus flows through the air, or how the air particles flow through the air, not necessarily virus. The other benefit of wearing masks would be not just from catching the virus, but also transmitting the virus, which is kind of like the bigger thing. We're trying to protect people because when we speak, when we sneeze, when we blow our nose, there goes the particles, the particles in the air, and that's how we transmit it for the most part. And also there's the benefit also of not touching your face. It's almost like a psychological barrier to say, okay, or a psychological reminder, I'm not going to touch my nose, so I don't put the particles on fomites or particles. So we talked about the cloth mask maybe about 50% effective. The surgical mask maybe around 90+% effective, depending on the manufacturer. And the N95 mask filters down to about 3.3 microns, and it's, as the name implies, it'll filter about 95% of the particles. And also depends on how we fit the N95, because in a hospital setting, it's not just wearing the N95. Like people go around, they're wearing N95s to Lowe's, Home Depot. It's not just that. It's having the appropriate fit testing that you get the appropriate N95 for yourself. Just on a side note, I went on the mass.gov website. I looked at KN95. So KN95 is a China version of the N95, and theoretically it should filter about 95%. But they actually tested it, and it's interesting. The majority will filter about 80 plus to about 95%, but even the unbranded ones, there's a big range. You could have about 20+% to about 50% particle filtration efficacy. So it's just kind of like, it's kind of like such a broad range of how effective the KN95s are.
Thank you for that. We'll go to the next question for the interest of time. Our next one is, how widespread is asymptomatic COVID-19? And this is, I would see Dr. Makatangay's opinion about this.
Yeah, so there was a study. So there's a question, right? There's asymptomatic wherein the person never really developed symptoms. And then there are some that is called pre-symptomatic wherein they were already positive for it. And then they develop symptoms later on. And I think this second one, the pre-symptomatic, is much more important, because in the slides, the slide that I showed earlier during my presentation, when they did the modeling of these individuals, assuming that there's this incubation period, it was around a median, I think, of 2.3 days prior to the onset of symptoms that they were already showed a lot of the shedding, and therefore transmissibility at that point. And then I think it peaked at 0.7 days prior to the onset of symptoms. And then there's a New England Journal paper where they looked at pre-symptomatic, where they looked at 23 individuals who were positive. Of those 23 individuals, 12 were asymptomatic. But of the 12 that were asymptomatic, 11 developed symptoms in the next 7 days, and one was never really developed. So as far as someone who's positive that never really have symptoms, I don't think it's that common. But the pre-symptomatic, wherein you're able to transmit the virus, you're shedding the virus, but then you later develop the symptoms, that is a bit more common. And I think that's been shown in a number of different studies. And that I think is concerning, because someone may be walking out there and not having any symptoms. They'll develop symptoms in 3-4 days, but at that point, the person's already infected and able to transmit the virus. And as far as public health-wise, those are the people that we need to consider. And that means, these social distancing and using of all, stay at home and all of these other interventions that we can use to prevent that from happening, the transmission in people who are asymptomatic or pre-symptomatic, to prevent that from continuing to increase the transmission rates and the number of confirmed cases of COVID-19.
A quick follow-up with that. There's a question from our listeners. One of our listeners is asking if the testing is for COVID testing, is that specific for the whole COVID virus? Because there's a lot of like coronaviruses.
Yes, that's an excellent question. There's actually some studies that show that there may be some cross-reactivity with SARS coronavirus 1.
Okay, thanks. Thank you, Dr. Makatangay. Our last question for Dr. Setna. Are children considered asymptomatic carriers of COVID-19, or they just present, or do they just present with mild or atypical symptoms that the diagnosis of COVID-19 may be missed?
So they CDC just put out that there, as much as 1 in 3 people can be asymptomatic carriers, and that would include children, but definitely the children have much milder disease and it could go undetected. So I would say either. And if I could just get one more, I saw a quick question in the chat and also another question. There was a question about COVID in newborns and affecting the brain. Just so, you know, newborns, we've had a bunch of moms coming in pregnant with active COVID-19 disease. And initially they were separating the infants from the moms, but now they're kind of together again. But they have had some infants turn positive, but so far none of them have had major serious illness that I am aware of, and nothing associated with the brain, but some have had respiratory involvement. And then there was one question in the chat about the environmental factors associated with MIS-C. So there are some environmental factors associated with Kawasaki, like they could be weather related, geographic related, but this seems to be like exact post-COVID triggered by a virus. And it's interesting, I think Mount Sinai is starting to collect DNA to see if there's any genetic predisposition in these kids who are getting it.
Thank you so much. I will turn the mic to our president, Dr. Candy Buencamino Francisco. Thank you everyone for speaking and lecturing today and educating our members and audience.
Thank you, Richmond. Thank you to all our speakers for that very informative discussion about COVID-19. And as you can see, there's still much to learn about this pandemic. And with the states and other countries reopening, I urge everyone to be vigilant in observing proper precautions to stop the spread of this virus. And as Dr. Atul Gawande eloquently discussed in one of his articles he wrote recently on The New Yorker, and I quote, "The 4 pillars of our strategy, hygiene, distancing, screening, and masks, will not return us to normal life. But when signs indicate that the virus is under control, they could get people out of their homes and moving again. However, there is a 5th element to success, and that is culture. It's one thing to know what we should be doing. It's another to do it rigorously and thoroughly. So please bear that in mind, and I thank you all for joining us tonight. So if you have any questions or suggestions on future webinar topics, please email us at pma.newengland@gmail.com. If you have any more questions about this talk that we were not able to answer, please send us an email and we will try our best to answer your question. Please also visit our website at pma.wildapricot.org for more information about our organization and future activities. We're also looking for donations to support our charitable activities here in the United States and the Philippines. Just one announcement, on May 30th, that's next Saturday at 5 to 6 p.m., we'll be having our General Assembly, which is for members only, so please try to attend. Our webinars are now available on YouTube. So please search for PMA New England, and I encourage everyone to subscribe to our YouTube channel. Once again, thank you very much and have a good weekend.